The Labor Department reported this morning that productivity rose at an annual rate of 6.6% in the period from April through June. This is the largest advance in nearly 6 years. Later this morning, the Commerce Department will have a report on factory orders. The National Transportation Safety Board has released 19 recommendations it says will make the emergency helicopter industry safer. It will be up to the Federal Aviation Administration and private operators to decide whether to implement them. NPR's Russell Lewis reports.
The NTSB findings come after a year-long study of the emergency medical helicopter industry. In 2008, there were a record number of deaths and crashes aboard the aircraft. The Safety Board wants the industry to train its pilots better so they can be more prepared when inadvertently flying into bad weather. The board also called for helicopters to be equipped with autopilots and night vision goggles, but the NTSB stopped short of requiring 2 pilots in each aircraft, as some other countries mandate. The board also wants changes in federal Medicare reimbursement rates, so there's reduced economic pressure to accept riskier missions. Despite last year's accident record, there have been just 3 helicopter crashes this year and no fatalities. Russell Lewis, NPR News.
2 American reporters who were jailed for 4.5 months in North Korea said they never intended to enter North Korean territory. Laura Lee and Eva Lee were working for Current TV when they were grabbed by North Korean guards on March 17th. In an account on Current TV's website, 2 reporters said they didn't spend more than a minute on North Korean soil before turning back, but they said it's a minute they deeply regret. I'm Nora Romo, NPR News in Washington.
Support for NPR comes from the Doors Youth Charitable Foundation, supporting the performing arts, environmental conservation, medical research, and the prevention of child abuse.
While there was good economic news yesterday, stump prices still fell for a 3rd straight day. Steve Beckner of Market News International reports.
Despite 2 month-ending down days, August was a good month for stocks, but September got off to a somewhat surprising negative start. Wall Street derived little cheer from favorable economic numbers. Most notably, the Institute for Supply Management's Manufacturing Index rose much more than expected to show growth for the first time in 19 months, led by a sharp rise in new factory orders. Other reports showed auto sales surging, pending home sales rising to their highest level in more than 2 years, and construction spending firming. But September has seldom been a good month for stocks, and nagging fears about the financial system prompted traders to book profits after a long rally. The Dow Jones Industrials and NASDAQ Composite fell 2%. The S&P 500 lost closer to 2.25%. For NPR News, I'm Steve Beckner.
With the deadline looming, Dallas-based Southwest Airlines reached an agreement with the Federal Aviation Administration to replace some plane parts over the next 4 months. Bill Siebel with member station KERA in Dallas has more.
The parts in question are segments of a flap assembly that deflects engine exhaust. The FAA says they must be replaced because the company that made them lacks written FAA approval. In a statement, Southwest said that as a result they must be removed regardless of their quality. The company said it's not a matter of unsafe parts on the plane. So far, Southwest has replaced parts on 43 jets, leaving 39 more to go. It now has until December 24th to replace them because the FAA agrees that they meet the requirements of the aircraft manufacturer, Boeing. Southwest is also able to avoid grounding the planes all at once. That would have been a costly option. For NPR News, I'm Bill Siebel in Dallas.
Homeland Security Secretary Janet Napolitano said this morning that Americans should expect a big influx of swine flu cases this fall. She told NBC's Today Show the best prevention is for people to do the very simple things, such as frequent hand washing. New York's Governor David Paterson has signed an executive order that allows New York City's off-track betting corporation to file for reorganization under Chapter 9 of the Bankruptcy Code, the section used for municipalities. OTB has long been in trouble. NPR's Margot Adler reports.
An audit of OTB first reported in the New York Post described a bloated payroll in too many outlets. The audit found that OTB had $24 million in operating deficits over 4 years, despite handling $1 billion every year. Governor David Paterson called the executive order an unprecedented move.
This is a necessary move. For a number of years, we have known that OTB is broken. It has hemorrhaged money and has been unable to be directly accountable.
Paterson said OTB employs 40,000 New Yorkers and has brought $4.5 billion into the economy. It's hard to believe a gambling organization can lose money, but the chairman of OTB said its flaws date from its inception. Margot Adler, NPR News, New York.
An 89-year-old man accused of killing a guard at the Holocaust Museum is to be arraigned in federal court in Washington this morning. James Von Broom is charged with 7 crimes, including first-degree murder. I'm Maura Rom, NPR News in Washington.
This is Morning Edition from NPR News. Good morning, I'm Renee Montaigne.
And I'm Ari Shapiro. One key factor driving up healthcare costs is the payment system for doctors. The more procedures they perform, the more they get paid. The health industry calls the practice fee for service. Many consider it a perverse system that lacks incentives to hold down costs. But the legislation working its way through Congress may not do much to change it. NPR's David Wellman has the first of 2 reports on the search for more cost-effective healthcare.
At President Obama's most recent White House News Conference, this was his succinct diagnosis of the nation's healthcare ills.
We spend much more on healthcare than any other nation, but aren't any healthier for it.
The remedy the president prescribed, though, was not healthcare reform, it was health insurance reform, a term he and fellow Democrats have lately begun using to describe Congress's effort to overhaul healthcare regulations. But one Democrat warns the problem goes well beyond health insurance. Tennessee House member Jim Cooper says the real issue is a system bent on telling consumers more is better.
The message of our medical system has been sell, 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 buy. And the real message should be, what's really going to help me live longer in healthcare?
And with the fee-for-service model for healthcare, Cooper says doctors have little reason to discourage the demand for more and more health procedures.
I liken fee-for-service medicine to the situation if we paid lawyers by the word or by the paragraph, we would have the longest legal documents in the world. Essentially, that's what we do with our doctors, but most of us don't realize it.
Maine Senator Olympia Snowe agrees with Cooper. Snowe is one of 3 Republicans working with 3 Democrats on the Senate Finance Committee to forge a bipartisan health care bill. She wants legislation holding doctors and hospitals accountable for both the cost and quality of their treatment.
The fact is, right now, we encourage volume over value. And so we've got to really analyze what is the net outcome, and procedures and the testing and the care that's provided, individual patients and by whom.
Other lawmakers, though, say incentives for cutting healthcare costs should be directed more to the patients themselves. Wyoming Republican Senator John Barrasso is also an orthopedic surgeon.
I don't see anything in this legislation that actually goes and gives incentives to individual people to stay and live a healthy life. Nothing that's aimed at helping people individually. And it's given incentive to that person to eat less, exercise more, and quit smoking.
Even outside experts say that while the healthcare payment system encourages waste, it's not clear what the fix is.
I think the truth of the matter is we don't know exactly what would be the best way to reform payment.
That's Karen Davis, a healthcare expert who's president of the nonpartisan Commonwealth Fund. Davis says the legislation pending before Congress does offer some incentives for more cost-effective healthcare. Medicare would crack down on excessive hospital readmissions. It would also be bonus payments for Medicare providers to improve the quality of their healthcare. And pilot projects would be funded as well.
There are pilots for medical homes like primary care. There are pilots for accountable care organizations, which certainly cover the continuum of care. But there are also pilots for bundling hospital payment. And I think all of those are very important to lay the groundwork for fundamental payment reform.
Arkansas House Democrat Vic Snyder, who's also a physician, says he still has hope for the healthcare legislation before Congress, which he calls a work in progress.
Whatever the final version is, we'll have this discussion maybe after the president's ink is drying on the document. Then we'll say, well, was it a little nudge, a big nudge? But it will be a nudge in the direction of more efficient delivery of healthcare services in a way that rewards